got Alyssa here, and I got Dr. Flemmings, however, Michelle.
Michelle.
Yeah, awesome.
Dr. Flemmings means I should be doing this like in room 7.
Yeah. Well, you got take it away.
No, we just
Sweet.
so
Dude. This is
this
so
is
awesome.
one of my favorite people in the whole wide world, and you adequately reminded me that this is our anniversary. So do you want?
I didn't bring a present. I apologize.
No, that's okay.
I hear
Me
it's
too.
paper. Here,
1
you can
year?
have my
Yeah,
ID.
yeah, yeah.
I hear it's paper.
I was to Toothberry last night making origami paper first, so I mean, I feel
Dude,
like,
you did not call me to origami.
I know.
Oh my gosh. Okay.
I was telling Michael I actually had to give up a lip gloss. Oh, I hope my kids don't watch this episode.
You gave
I
up
got a
lip
girl
gloss.
audience. So.
Was it that awesome?
It was that awesome. It was
What
like
color?
A
What was the
molar.
color?
It was like a
Oh.
gold. It was just, yeah.
All
I had to
right.
get,
Yeah.
Okay,
All right,
so
let's-
here we go. We're bringing
It was
in.
righteous.
Do you
Sorry.
want to start again?
No,
Okay.
just keep
He'll let it. So cool. So a year.
All right. It's been a year.
And you have been busy.
It's been busy, and you have been busy.
Yeah.
So let's dive in.
Cool,
so
girl.
We met at Vive.
We did.
You were wearing an awesome pink blazer, and
That
was just
is
giving off
in
this,
my
yes,
picture
that's
this
it.
time.
And just giving off this energy, and then I thought, I don't know why. I was like, I need to know her. And I sat down next to her, and we started chatting, and we were like, what do you do? I'm like, ER doc. I'm like I'm an ER doc, and so.
Yeah, she does the little people. I do the taller people.
yeah.
Well, they're taller than me usually.
Yeah.
But yeah, and then we connected on that, and we were like, huh,
So
where
you're
does this
both ER
awesome
docs.
go?
We
Yeah.
are.
Wow.
Yeah.
And
I think
just focus
between
on the
us,
little ones.
I think we've got like 70, 80 years between
Yeah.
us in EM, at least. And I don't know how many thousands of
Yeah,
patients.
thousands.
Thousands.
It's hard to think about.
So
that.
Yeah.
where do we need to go with healthcare?
Well, okay, or how frank can I be?
Oh, very.
I've got a
Yeah.
lot to say.
Yeah. Okay,
we're
let's do it.
PG-14.
I started, let me think, I finished med school in 1985. So I graduated before HIV, before AIDS became a chronic disease. I came out when we had the little zappers in the waiting rooms because we had multi-drug resistant TB. I came out when
Oh,
paper
wow.
was king. And when we thought we were badass because we could print out our EKGs on this paper, we didn't know though that when you burn it on the paper, about maybe 6 months later, it starts to work like disappearing ink.
Yeah,
So you
yeah.
can't see what went on, and there's no what's different today. That was gone. So history was gone in front of our eyes. Handwriting sucked.
Yeah.
People were writing around the edges. We found out that green ink didn't copy as well. And we also did a great job of faxing people's records to the wrong hospital because it went in with somebody else's paper. You know?
Yeah.
So we kind of sucked at healthcare, although we were doing our level best.
Yeah, yeah. Although the quality of the care was still so good, right?
We were
I mean,
at the bedside.
yeah, it was
Yeah.
all about the relationships and the
Totally.
interactions and
Yeah.
the humans, right? And so we have become so much more tech savvy. And I heard not too long ago, because I also grew up in the paper chart era.
Yeah.
And then when we started to have EHRs, it wasn't one, it was three. And one was to document, and then one was for imaging, and one was to discharge, and then one was for meds. I mean, it was really
And
crazy.
then two would usually not work at the same time.
100%.
So then you had to go
Yeah.
back to paper and figure out, okay, where was I? And then how do I staple this together, make certain I scan it into the right record on the right program.
Yeah.
So it was crazy connecting all this stuff. And then we got end to end. What is it they call it? The longitudinal record.
Oh, yeah. Okay,
Yeah,
that's
yeah,
I
yeah.
haven't heard it like that.
Well,
So,
and the hard part there, though, is when you're on the receiving end, ER doc to ER doc, are you kind of sick of having all of those little dots that tell you you can bring in all this information? And all you want is that one thing
Yeah.
that says, did they get their tetanus shot a year ago? Or
Yeah.
I don't care if you got a pneumonia shot in 1970. I could care less. I want to know if you got it 7 weeks ago. I want to
Okay.
know if you got it this
Yeah.
year.
yeah.
But then there's this deluge of information that I don't have time for because somebody's fixing to die always
Yeah,
in the
yeah.
ER, usually in the waiting room. You know, the surprise
Oh, wait.
visit
Yeah,
that
yeah,
just
yeah.
like.
Or in radiology. That's
Yes.
Other people
It's
go
funny.
to die.
I had a-
Sorry, radiology.
I had a
but we don't mean
professor
to do
who
that
used
to
to
you.
say that radiology was God's waiting room, and it's so true. Stuff happens.
Stuff, unfortunately,
Stuff happens. But yeah, so we ended up with, you know, the megaliths of EHRs, which are better.
Yeah.
I'll give them their props. I've worked for a couple. But still, I think that we should do better.
Yeah.
And I think it's time as physicians that we stop whining about it and we take the bull by the hand. Well, you know how your mom, when she was upset with you and she wanted to get your attention, she'd grab you by the ears and like, look at me,
He's like, no.
look at me.
That's what my wife does to this
You know?
day. So I'm sorry, I love you.
My mom was a teacher in the Bronx. God love her.
That's where
And
I was born. Wait,
no kidding.
Yeah. Sorry.
Mom I didn't know this. But Mom taught in the Bronx, and she was about that big, and she would do one of these.
Oh, forget it.
Yeah, and
no.
then I was like, even to the day that she died, if she looked at me like that, I was a grown woman, I'd be like, okay, whatever it was, I'm never going to do it again.
Never.
We need to do that as healthcare providers. Stop whining, stand up. Because we just said it. What happened with tech is two things. We were told last time that CPOE and tech was good for us. They said, pet the dog. The dog is nice. The dog is really friendly.
Yeah.
We petted the dog bit us and then dragged us around the yard for however many years that tech's been dragging us. It's time for us to say, done. Done. It's time for us to say, we need to have tech happen with us, for us, and through us on behalf of our patients, because I think that we get lost a lot of time in the next shiny object.
Yeah.
What's the whiz bang? What's the cool? What's the gadget? What's the gizmo? What are the cool colors? Truth be told, I could give a rip what color my buttons are. I just want to know that it's over here so I can sign and go on to my next thing. You?
Totally agree. Yeah, and I think it's all a double-edged sword, right? Like, I don't think there's any one of us who work clinically that'd be like, you know what? Forget the EHR. Let's go back to paper, right?
no,
Like, we wouldn't do that.
Yeah.
But it doesn't always work. And then you see the increased burden, or because there is the EHR, you have all of this data at your fingertips, but it's not curated. So it's not really what you need when you need it. It doesn't give you the longitudinal history that you wanted to tell you who's at risk. And I know, like, people are probably going to listen to this and be like, but that's what we're working on. And that's where we're headed. But I heard something not too long ago about the EHR era being the electronic era, and now this is a digital era, because it backfired in so many ways. People don't want to equate the two, which I thought was a more honest assessment, because it was this electronic era that I think had to happen.
Totally.
But, like, could we actually do better, and what does better look like? And so here we are.
Here we are.
So what does better actually look like?
Well, we're at Vive.
We are Vive.
We are at Vive. And the coolest thing about this conference, and why I think it's going to be, it's starting to come up as the premier conference, but I really think it's going to squeeze everybody else out, because what Vive does, I think, better than any of the others, is it takes all of the bright lights and the, I'm Dr. Blankety Blank from Blunken Blunken University, and I have 27 letters behind my name, therefore I am, and you must listen, to, you know, that dude over there in the Birkenstocks and the cut-off shorts kind of has a lot of cool stuff to say, and it makes sense. I think that's what this conference does better than any others, is the collaboration, the honest discussions, and just taking away the veils and the pretenses and the thou arts and the thou has and all of that layering and hierarchy, and it reduces it to, can we just get stuff to work and make patients better? And that's where I think digital is a magnificent thing. However, let's do the segue, because the segue that's obvious, and you and I are crazy fearless, but we have to talk about the fear versus the FOMO.
Yeah, let's do that.
Because there is a fear of missing out. Wow, that's a really cool thing. My legacy stuff kind of sucks. Let me rip out, replace to the tune of I don't know how many zeros, because it's a bunch of money. But then when you start putting in, we talk about curating. How do you know what is the most impactful, enduring, long-lasting, going to get you the outcomes results, first for patients, second to not piss off your docs and nurses, because we've never figured out how to grow either on trees, and then after that, how do we make certain that that financial bottom line stays above water? Because we just had an article, I think it was last week, that Becker's put out from, and I think it was Chartis did the study, about 400 plus hospitals, rural hospitals in the US, are at risk of closing. Thank you. Gut punch.
Yeah, it's
I
gut
live
punch.
rural. I live in the Four Corners. So my closest hospital, thank God, is sitting in Durango, Colorado. Great. My closest level 1 trauma center, I have to fly people across the mountaintops to either Denver, over to Colorado Springs if it's pediatrics especially, or I got to get them down to Albuquerque, which then brings, unfortunately, insurance issues and financial burden for patients. So how do we make certain that we keep those littler hospitals open and not bring them to places where they're saying, I'm not relevant because I don't have the latest things?
Yeah.
And I think that's where physicians come in handy.
I totally agree with you, and I think that's where the tech comes in also. Like, we've talked about this many times, like, if technology can really be the great equalizer and close the healthcare gaps. And you mentioned something, and I just want to point it out, that you live in a rural area.
Big
and
time.
I think people in tech just unfortunately, maybe physicians also have this misconception of who actually is living in rural areas. But it's us. Like, it's all of us. You know, I'm fortunate to have worked for a startup, and they had a child, and they couldn't access ultrasound for their child, even though the startup is focused on ultrasound. Like, what's the irony there?
Yeah.
The closest ultrasound for this baby at birth was a few hours away. But, like, think about that.
Yeah.
I mean, this is someone who's dedicated their life to developing ultrasound for babies.
Right.
And here they
And
have a
can't get
baby,
one.
and they can't access ultrasound, right?
Oh, yeah.
So it's a good reminder that you're a physician, exec, and you're successful, and you're focused on all of this, and you also live in a rural area. Like, those things can be true and not unrelated. It's all related. But again, I think sometimes we're like, oh, a rural area, and it's, you know,
And most of us live in those.
Most of us live in
You know,
those,
I mean,
you
I
know?
lived in New York City, and I was, you know, I couldn't swing a dead cat without hitting a level 1 trauma center where I was. I never told you that one.
No, that's a new one even for me.
But I mean, there was one everywhere. If you fell over, it depended on which corner you landed on as to which EMS was going to take you to what hospital. It was so well put in. But we don't have a grid when it comes to rural.
Yeah.
You know, sometimes we can't get there from here because the weather won't let you.
That's right.
You know, sometimes you fly to Denver via Albuquerque because of the weather.
Right.
So I think that these are some things that clinicians, we need physicians, we need nurses, we need RTs, we need anesthesia, we need everybody to come together and say, yeah, enough is enough. And tech, you need to understand me, what I need from you, what I do every day for my patients, and the results I'm trying to achieve for my patients. And I don't think that we do that well enough. God loves startups, though, because they will try and find you. The hard part, though, is that we're so busy because there's so fewer of us. What was it, 1.4 million of us? And now we're down to like 900,000? Yeah.
So 900,000 clinician docs.
Yeah.
Wow.
And then there's a bunch of them, and I don't remember the percentage, but a bunch are aging out because they're tired. And then there are others who are sick and tired who are going to
So
go.
I'm so glad you're here. I see this as just a start of multiple segments. I hope we can get you back. You guys are just going.
I will hang with Alyssa any day.
Likewise.
This is my girl.
Yeah, you know.
So as we wrap up today, it seems like you have these wordisms, these epiphanies for us to march through by.
Please.
What would you help clinicians, startups?
Everybody. Okay, let's start with clinicians.
Let's do it.
I think that it is time for us to step from being pissed off to being empowered. And for us to really take our insights, our expertise, and all that learning and help to make certain that when we drive change, we're driving the outcomes that we know that we need and that our patients need.
Yeah.
You know, I think that's number one.
Agreed.
I think number two at Vive, something that women do so well, we network differently because we met in a room of I don't know how many hundreds of people, and we've stayed friends.
Yeah.
I went to a conference 2/3 of the way across the country to support her because she was going to speak.
Yeah.
Really, I mean, it was my
That's
first
awesome.
time being on a panel like that and
Yeah.
moderating, and she's like, well, I'll come. And I was
I'm
like,
coming.
But
Wow.
like,
Yeah.
is your company sending you? She's like, no, like I'm literally just
I'm
coming
just coming
to support you.
to support you.
Right.
Showing up.
Yeah,
Showing up.
Yeah,
It's
the
huge.
power of showing up.
Yeah, and I think especially here, I mean, there are women's leadership groups. We're going to have a, oh my goodness, the League of Women is having a panel today at noon. And I think that everybody should come, male, female, whoever, because we're going to be talking about the enduring insights that women who just, quote, age out of the traditional workforce, what else we can still do and how we can either be mentors, how we can be experts, how we can be consulting, how we can be podcast guests and help to continue the conversation.
Cool.
I think the other one after that is that we come here a lot of times to see and be seen. Let's stop seeing and be seen, and let's have some good conversations. Let's network, not for the sake of collecting a card, but for the sake of creating a moment, an inflection point. Because I met Alyssa, and it was just like, okay, we have way too much to say.
Yeah.
And since then, I've retired.
We've said a lot.
I've gone back into coaching. I've gone back into consulting. We talk on an ongoing basis. We introduce each other to folks. I mean, she introduced me to you.
I love, we have way too much to say. I think and do.
Yeah.
I love that. This is empowering.
Maybe
so
that's the
much.
series name.
Yeah.
Yeah.
We have way too much to say.
Yeah. So let's do it.
All right.
Sweet.
So
Thank you for this.
Yeah,
This has
thank
been
you so
awesome.
much, yeah.
And always, hey, Mama. Good to see you.
Thank you for coming.
Don't tell the girls about the lip gloss.
No, we
Yeah,
won't tell them
yeah,
about that.
no,
But
yeah.
to everyone listening, break out of the comfort zone. Go up to the random person. This is a place to do it, and I think people hopefully will be pleasantly surprised. You never know what comes from that. So
Dude,
thank
you
you
know
for
me.
coming on. I'm
Oh,
so
sure.
grateful to you for all that you've done.
Psyched to see you. Always here for you. Always.